Welcome to the Research Works podcast, brought to you in association with Curtin University and the Healthy Strides Foundation. Your hosts are Dr. Dana Poole and Dr. Ashley Thornton, and together we will interview world-leading researchers in the area of child health to support your practice in being more evidence-based.
The team at the Research Works podcast acknowledges the traditional custodians of the land and waters on which we live and work. We pay our respects to all First Nations peoples, elders past and present, and would like to acknowledge the traditional custodians of the land on which we record this podcast each week, the Whadjuk people of the Noongar Nation. We recognise their continued connection to this beautiful budja we call home.
Hello, everyone. It's another week and another great episode here at the Research Works podcast.
Yeah, it's my favourite time of week, that's for sure. And this week we are actually heading back to South America. So it's really exciting to see all of the publications that are coming out of Brazil at the moment. And today we have one of the authors from that team and the lead author on this paper, Professor Hércules Ribeiro Leite, on the show. Welcome and thank you for staying up so late to chat with us.
Hello, everyone. What a pleasure. I'm so happy to join you guys on this amazing podcast. Thanks again for inviting me. I'm a big fan of Research Works podcast.
Oh, we love hearing that. That's really, really great. Look, we've been looking forward to speaking with you for quite some time now, and we do want to acknowledge that it isn't the easiest time zone to coordinate. So we're really grateful to have your time, and we've been hanging out to chat with you, and been waiting for this paper to be published as well. We'll get into that in a little bit, but I think people would be quite familiar with your work from some of the things we've discussed over the last few episodes of the podcast as well. You know, we've spoken to Paula Shagas, Egma Longo, and not to mention as well, we have the Australian Georgina Clutterbuck and Anna Carolina de Campos. So there's a lot of relationships through all of that. And that's the beauty about research, isn't it?
And we've been waiting a little while for this paper in particular to be released so that we could talk to you specifically. And it's finally here. So for our listeners, this paper is hot off the press, published in Disability and Rehabilitation. It's titled Moving Together is Better, a systematic review with meta-analysis of sports-focused interventions aiming to improve physical activity participation in children and adolescents with cerebral palsy. And as we said earlier, you're the senior author on that paper, so congratulations, Hércules.
Yeah, thank you. So finally, the paper has been released. And great Brazilian team on it. This paper is part of the my PED candidate, Ricardo Jr., coordinated by Georgina Clutterbuck and Ana Camargo, a colleague from here. Yeah.
Oh, it's so good. It's so very, very good.
Yeah.
Congratulations.
And as we said, we've heard a little bit from some of your team members before, but I thought we'd tell our listeners a little bit about you, Hércules. So Hércules Ribeiro Leite joined the Department of Physical Therapy at the Federal University of Minas Gerais in December 2019 and has been a professor of pediatric physical therapy in other public universities in Brazil since 2012. Hércules is an early research leader in Brazil, contributing as an author to over 60 peer-reviewed journal articles and book chapters. From 2017 to 18, Hércules concluded his postdoctoral fellowship in physiotherapy at the University of Sydney. In 2019, he and colleagues published a book in pediatric physical therapy, From Evidence to Clinical Practice, which is one of the main sources of knowledge from clinicians and students in Brazil. He's been an invited lecturer and keynote speaker at important national conferences in Brazil. Hércules is interested in childhood disability, family-centred service, sports and leisure participation promotion, and knowledge translation. Hércules has been supervising masters, PhD and postdoc students across all of these topics.
My goodness, what a track record. And Ash, what great pronunciations. I'm so proud of you. That's so good. You've done it again.
Oh, I'll ask for feedback later, Hércules. I'm sure I messed some of that up, but that's okay. And Hércules, as you know, because I know you've listened to a few episodes of our podcast before, we like to ask a little icebreaker question to start the episode off. So today I thought I would ask, because I don't think we've covered this on the podcast before, do you have any phobias?
Oh, that's a good one.
Yeah. Yeah, this is a very compromising question, but I'm going to tell you guys the truth, right? So do you know that situation when you notice a cockroach before you went to bed and know you want to rest until you know how to keep it away while you sleep? So exactly that's my phobia.
Just that absolute fear that it comes skedaddling across your face while you're sleeping.
Yeah, I can imagine that.
Oh, so if you see one before you go to bed, that's it. No chance
over.
of sleep.
So when you come into work the next day and you're really tired, you'll be like, what happened? It's like, man, it was this cockroach. Oh, that is a very interesting one.
Yeah.
Okay, so look, I don't like insects for sure, but I would say in terms of a phobia, I've realized that I really, really dislike heights.
Okay.
So and I really notice this when you start traveling, you go to Europe and you go to these like towers and there's more things to look at. So there's all these balconies and I was like, oh, this would be great. I remember the first time I stood out onto one of them, I'm like, nope, no, thank you. And so every
cold sweat.
I just can't do it. So I'm always up against the wall and I'm like, oh no, I'm cool. And everyone's taking their photos and I'll hold everything really close to me and I'll try to act cool about it, but I just don't like it. And then bridges or steps going up to bridges if there's gaps between them so you can actually see through it.
Yeah.
Can't handle. I'm like a bit of a mess. So yeah, there we go. That's me.
A little window into your soul, Dana.
Very compromising, as Hércules said. Very true.
Yes.
Yeah.
Ash, what's this one?
Well, I feel like this is a safe space so I can share with you just how weird my phobia is. And I felt comfortable asking this question because I knew that no one would have one that is weirder than mine. I feel like I always have the weird answers to the questions, but so I have a terrible phobia of cotton wool.
Oh my gosh.
So if I touch it or it touches me, I get really sweaty and I start like shaking and I want to vomit.
Oh my goodness.
That is so cool.
Yeah.
I don't know why, but I have this urge to test it out. I just want to bring them out.
So at school when you used to have to do like arts and crafts and make the sheep or the snowman or whatever you were making, that was just a really traumatic experience for me.
Oh, Ash.
Yeah.
So like what do you use to take off your makeup? Like you just
like a flannel or the pads, the cotton pads are okay. It's the balls that and my mum used to have a big like bag of them in her bathroom.
Yes.
Yeah.
I'm glad you feel so safe to be able to tell us that one. That is definitely a different one. So yeah. I mean, guys, if you're listening, you've got one that's weirder than that, send them in. We'd love to know what they are.
That will help me feel better.
It'd be great for Ash.
Thank you. Yeah. We're all friends here.
All right. Well, let's. I'll remember this for a long time. But let's get into the topic of what we're here to talk about today.
Good idea.
Okay, so the aim of this paper was to analyse the effectiveness of sport-focused interventions on the participation of children and adolescents with cerebral palsy. In this systematic review with meta-analysis, articles were included if they were RCTs that investigated the effectiveness of any sports-focused interventions in children and young adults aged 5 to 24 years of age with cerebral palsy compared with any control or comparison. Outcomes had to include participation attendance or involvement assessed by standardised measures or individual goal-focused measures. The findings of this review suggest there is moderate evidence regarding the effectiveness of sport-focused interventions on leisure time physical activity participation in children and adolescents with cerebral palsy. Group interventions are effective in improving leisure time physical activity participation, and sports-focused interventions didn't improve participation in other life areas. The outcome of this review provides valuable information for clinicians to promote appropriate rehabilitation programs for children and adolescents with sports and recreation goals.
Thank you, Dana.
Very welcome.
It feels very timely talking to you about this paper, Hércules, not because it's just come out, but because the Commonwealth Games has just finished, which, Australians love their sport and they love an opportunity to watch sport at the highest level. So obviously the Olympics and the Commonwealth Games are an opportunity to do that. But I think the entire world is just sport mad. And I know, over in Brazil, we think about football.
Same
here. Brazilians love their football, but let's just set the scene a little bit and maybe I could get you to summarize why sport is so important and how that contributes to physical activity.
Yeah. So as you know, overall sports help children develop physical skills, get exercise, make friends, have fun, learn teamwork and to play fair, and also improve self-esteem. And of course, it's good for health. And okay, so sports so important. And they who recommend, for example, that we must be engaged like adults, at least 150 to 300 minutes of moderate intensity aerobic physical activity, or at least 75 to 150 minutes of vigorous intensity aerobic physical activity throughout the week. So sports and physical activity, they are so important to promote health and well-being.
And if people enjoy participating in sport, that's a really nice way to get those minutes of physical activity up, isn't it? Which we know has all those great health benefits. Yeah,
exactly. So I think it's also important to mention, because it's quite different a little bit, the recommendations for children with CP. And actually, children with CP meets the recommendation guidelines when engaged in moderate to vigorous physical activity for at least 60 minutes per day. Activities that make them sweat, feel more tired and breathe more than usual, like dancing, sports, playing with a pet, so on.
And why is that so important for children with cerebral palsy?
It's already known that children with CP demonstrates reduced physical activity levels, and also they are engaged in significantly more sedentary time than their typically developed peers. So overall, here I would like to highlight here two main benefits of physical activity in that population. So first, I think physical activity is so important to reduce sedentary behavior. And also to promote social, cultural, psychological, and cognitive benefits on that population.
No, it's a really important point.
Yeah, I love how you spoke about both of them. I think increasingly we understand more now that, physical activity, sport, the ability to sweat and exercise, get your heart rate up, those are really important things for our health, but so are all the other elements of it. You spoke about confidence and self-esteem and just the psychological benefits that you just said. That's really valuable, isn't it? And we all need that.
Yeah, absolutely.
Yeah. And Hércules, maybe you could also talk to our listeners about this concept of leisure time physical activity and why that's important.
So leisure activities can be defined as activity freely chosen, performed when not involving self-care or school. But we can also define leisure time physical activities into, for example, during sports. For example, organized physical activity with competition and formal rules, but also physical recreation, like those unstructured physical activities, and just aiming health, well-being, and enjoyment.
So you have much more of a choice around how you spend that leisure time. So it's not kind of the structured sessions that you might see, as you said, in a school in physical education, but it's, with your spare time, how you choose to spend it, basically.
Yeah, exactly.
I think that's a nice way to put it, isn't it? That you choose to. And that is the difference, isn't it, with leisure time? Because there's so many things you could choose to do. There's so many things that can distract us these days, and most of them are sedentary related, aren't they?
Absolutely.
So, we want to put that option on the table. So, look, just to contextualise a lot of this now as well, we've spoken to Dr. Georgina Clutterbuck about the SPORTDiscuss intervention. So can you tell us a bit about the sports participation framework for children and adolescents now? Yeah,
absolutely. This framework is just amazing. So So the Sports Participation Framework acronym was created for children and adolescents with disability to describe 6 different stages of sports that children and adolescents with disability make progress when it comes to leisure time, physical activity participation. It's important to state that the first 2 stages of this model, phase S and P, are interventional stages, hereby defined as sport-focused intervention. So, for example, the first stage, the stage S, which means screening, goal setting, individual preparation, and includes interventions commonly conducted by health professionals. And, so, example, allied health physiotherapy.
Okay.
The second stage, the stage P, includes practitioner-led peer group sports interventions and are also conducted by health professionals. Okay. And here, and interesting because on this stage, the interventions focus on using real-world contexts to improve the transition, like a bridge, from individual interventions, phase S, to participation in community programs. Example, SPORTDiscuss Australia and now SPORTDiscuss in Brazil.
That's so good.
And at the end, the ORTS or RTS stages represent a common pathway that children and adolescents usually follow when practicing sports, depending on their preferences, abilities, and availability. Yeah.
I love that transition. So you've gone from, the ability, to work on a skill that you would see in therapy to making that next step where you generalize it so actually the therapy that you're working on makes sense in that context. And then it's more very community driven, very much, based on choice and, all the things you just spoke about there. It's a lovely format. I love it.
Yeah. I love that too. It's amazing.
Can I just follow on with a question with regards to the ORTS, the need for physical literacy? And we talk about that in terms of being able to be competent in, in playing more organised sports. Can you tell us what physical literacy is?
Yeah, this is very important and a good question. Physical literacy is a relatively new concept that describes the skills needed to participate in and enjoy in lifelong activity. So they must integrate not only physical competencies such as gross motor performance, balance, and endurance, but also other components such as cognitive, psychological, and social competencies.
Right. Yeah.
And a lot of the evidence, I think, suggests that it's those individuals who are more physically literate who actually stick with sports and recreational physical activity throughout their lifespan, isn't it? So it's, there's obviously lots of dropout of young adolescents and young adults in those more structured sports pathways as they get a little bit older. But we know that, the more physically literate people are the ones who stick with it for longer. So that's why it's really important that we try and encourage children to become as physically literate as possible in childhood so that they maintain those benefits. That makes a lot of sense.
Yeah, that's really good.
Exactly. Yeah.
So Hércules, with all that beautiful background and context, I thought we could now ask you about the aim of this systematic review and what it was that you sought to do.
Yeah, great. The systematic review aimed to analyze the effectiveness of sports-focused interventions on participation in leisure time physical activities, and also overall participation in children and adolescents with CP. And I think it's quite important also to define this sports-focused intervention, because here was defined as any modality provided by health professionals that contributes to participation in leisure time physical activity, okay? So we were looking at phases S and P of sports framework participation.
Yeah, that's really important. And could you briefly describe what kind of articles you included in your review?
Yeah. We included randomized control trial studies. We also included children and adolescents and young adults 5 to 24 years old with CP, compared with any control comparison. And also studies must have included participation outcomes of attendance and or involvement, and assessed by standardized instruments or questionnaires or individualized goal of focus measures.
Yeah, that's really good. So I love that you included up to 24 years of age. I really like that you sort of include that whole range because I think it's really important, isn't it? Sometimes we stop too early and it's 18, but the effects of what we want to see is that long-term change. And I just love that you did that. And I love that you included the different elements of participation, really teasing that out, which is really, really great.
Yeah. Particularly when you're talking about physical literacy as well. Like we've just talked about how it's, that transition period into young adulthood is often a lot of, it's quite a vulnerable time in terms of dropping out of organised activities. Yeah. So from that point of view as well, it's nice to include them in your sample.
Yeah. So important to think about this transition. Yeah.
So we see here that with regards to the results, that there are 10 original RCTs that were included in this review, with 7 investigating sports-focused interventions in comparison with control, and 3 studies comparing the effectiveness of 2 different interventions on participation. So given that, Hércules, can you tell us what your team found on the effectiveness of sports-focused interventions on participation?
Yeah, great. So I think first, it's important to state again that the included studies were classified as phase S, individual interventions, and P, group interventions, okay? So considering this context, we performed a meta-analysis, and we found positive pool moderate effects on leisure time participation, only seen in group intervention studies, such as modified sports, gross motor training, and fitness training, short-term follow-up. Compared with control. However, sports-focused interventions did not improve overall participation. Think about the group interventions, okay? Thinking about the individual interventions, phase S, we found no statistically significant pool effect for that, okay? So, in general, that was the main findings.
So just on that one there, why do you think that was the case with regards to individual sports-focused interventions? Why don't you think that resulted in increased leisure time, physical activity participation?
Yeah, I think especially thinking about the active ingredients and thinking about physical literacy, the large majority of these interventions, individual interventions, actually had main focus on physical domain. So focus on cardiovascular endurance, strength, muscle performance, and practice of motor skills and strategy and planning. Yeah.
And I guess when you're thinking about those individual interventions, I'm thinking myself as a physiotherapist, that might be, you'd be very focused in your individual sessions, aren't they? They're muscle strengthening. You might be practicing the elements of like kicking a ball or catching a ball, but you're not really practicing that in any sort of context. You're just looking at the core ingredient skills, aren't you, in terms of what that individual sessions might look like. So I know that's a little bit different then from the results you found from the group-based intervention. So can you just talk us through that result? I know you just sort of summarised it there a little bit, but why do you think there was a difference there with the group?
Yeah, we think especially because group interventions presented a mixture of several active ingredients related to all physical literacy domains. So, including characteristics of this stage, like social, cognitive, psychological ingredients to enhance patients' confidence, strategies, social skills, and engagement. I think additionally, interventions such as modified sports was also provided sports education, right? Introducing, for example, culturally relevant sports to children with CP, and also held in the community, like in parks, gyms, and school. I think it's a very good point to highlight.
And I think, it highlights really that, like you said, participation is influenced by many different components to the puzzle, isn't it? So, the individual interventions where you're just focusing on perhaps the motor or the skill-based side of things, the opening that up to apply those skills in a group context allows much more opportunity to bring in some of those other domains that we know contribute to participation, doesn't it?
Yeah. And I think that to me, I already sort of think, well, how you just defined before what physical literacy was. You can't just, it's physical literacy. There's a whole spectrum of things you need to look at. And if you're just looking at one domain, which often is your individual sessions, you're not looking at all the rest of it. So it makes sense that, you're not able to see those changes in an individual setting. So it doesn't mean the individual setting isn't important, but it addresses one really crucial component of it.
Yeah.
But it can't possibly address all of it. And therefore, the group-based settings are very important to make that next step. And again, that's the sports framework, right?
Yeah.
Yeah.
And
exactly.
And I suppose, to go back to the individual interventions as well, for therapists who are working individually with, children, that there is an opportunity in those individual sessions to start to bring in some of those broader components of participation, isn't there? Like, if there's a child with a goal that, is quite sport focused, you could start to talk to them about the rules of the game and start to talk about strategy and give them the opportunity to practice that in your sessions before they then, move into a group setting. So it doesn't have to be limited in that way.
That's true. Yeah, there's other elements you can look at.
So Hércules, we talked a little bit about the active ingredients of sports-focused interventions, and this is something that's been used to describe functional mobility interventions in cerebral palsy as well. So we love this concept of active ingredients and how we can, maximize the time that we have with, the children that we're working with. And so could you talk us through what the active ingredients of sports-focused interventions are based on what you found?
Yeah. So it was very different across the studies. So we found, for example, physical ingredient, and the majority of the studies that I have mentioned before, working on movement skills, strength, stability, balance, training. In the second place, cognitive, including content and rule knowledge, working on strategy and planning. We found social ingredient because social ingredient is important too in strength, relationships, and collaboration. And the last one, the psychological, so including motivation, confidence, and self-regulation. So these 4 main domains, but also finally the environment. So some studies we were able to identify studies covering, for example, accessibility for sports and recreation programs, family support. So that was the main ingredients that we found across the studies.
I love that. I mean, I love that so much. I loved hearing about active ingredients. I was just listening to an advertisement last night, and it was about Nurofen and anti-inflammatories, and they were talking about another brand. They go, but it has the same active ingredient. I'm like, hey. We have active ingredients too. And the reason why we love them is because if we can apply as many of those elements as possible, we increase the probability of a good outcome.
Absolutely.
I just love that you've just spelt it out on all that front. And as a clinician, I can go, okay, in my sessions, if I really, if I introduce another child into the session, I can, do some more play there and interactions and learning the rules. And just like you said, Ash, like you can incorporate so many of those elements. If I do it outside of a clinical setting and go onto some grass and uneven surface, I'm looking at the environment. And I love that you're saying what's really possible and you're giving us the tools for that. It's so great.
Yeah.
Yeah, thank you, guys.
Yeah, and I think the work that you've done in this paper and actually putting it down on paper, for anyone listening who then goes on to read the paper, and I hope that you all do. Table 3 is a beautiful roadmap for how to design a session so that it incorporates all those elements of physical literacy.
Yeah. It's a great framework.
Oh, thank you. Thank you to hear that.
So I guess the last sort of question I sort of had from you is what sort of advice would you give to clinicians? I know we've spoken a little bit there. The findings from this systematic review were simple. They told a story that was just like I just love that it's just so clear. Individual sessions do this, group sessions do that. Task specificity is important, and here are the active ingredients to think about to get our kids more physically active. I love that. Do you have anything else that you would like to add with regards to, your advice to clinicians about what they could be doing in their practice?
Yeah, I think our results reinforce the importance of some principles of participation-based therapies for children with disability in order to promote participation, such as to provide goal-directed, family-centered intervention, self-determined, and also ecological intervention. So I think taking together interventions to improve participation might need to provide specific test practice in real-world environments and to be relevant to families' participation goals. I think that's the main point to highlight here.
Yeah, I love it. Yeah, it's so consistent now, isn't it? When you're looking at the literature and the recommendations for this area, what you just described, there's also the functional clinical guidelines, being goal-directed, family-centered, task-specific, and looking at how it can be generalized into real-life environments. We're consistently as researchers finding the same things now, which is really fabulous.
It's a great message to get out there.
Yeah, it is. It is. Yeah.
All right. So, Hércules, where to from here? We know you're incredibly busy and you have lots of projects going on. What's next for, what are the findings of this systematic review lead you to next?
Yeah. So here in Brazil, we are dedicating some amazing projects. One is to implement SPORTDiscuss here in Brazil. So focus on real world environments, raising families' participation goals. And this clinical trial is focused on children with CP, and in another clinical trial with children with and adolescents with autism. So we are trying to study, of course, first, and trying to implement this new intervention here in Brazil. So
that's so exciting!
Good. I love it.
Yeah.
I love it. I love how there's so many cross collaborations that have been happening to make that work as well. Very, very exciting. Yeah.
Oh, you'll have to keep us up to date with, how that goes and your findings. And we can talk about that another time.
That's right. There'll be another one we can talk
amazing.
to you. Now, look, we're not done just yet, Hércules. As you know, we have a final segment that everyone seems to love, as they keep telling us. So we're about to head in now to the Tell It to Ed. Now, Ed, as you know, is our producer. He doesn't have a background in child health, but he has been listening to all of these episodes and he's learned a whole lot. The fact that you're from Brazil and you talk about sports, the fact that he's a Dutchman and also loves sports, I just know where this is headed already. So anyway, let's see where it does go. Now, in about 60 seconds or so, Hércules, can you summarize this research to someone who doesn't have a background in child health? And Ed, you'll have an opportunity for a question. Take it away, Hércules.
So, hey Ed, this study aimed to analyze the effectiveness of sport-focused interventions on participation of children and adolescents with cerebral palsy using the sports participation model, which is a model, Ed, to understand different scenarios related to participation in sports and physical recreation. It's a pathway from the clinical setting to national or international competition opportunities, depending on the preferences. So our data ads show that group interventions, which contain potential ingredients such as enhancing child's confidence, strategy engagement when practicing with other peers, helping the community, are most likely to promote participation in community leisure, time physical activity. So therefore, clinicians should consider group interventions as a bridge for individual health service interventions and leisure time physical activity in the community.
I love it. That's such a great summary. Thank you very, very much. All right, Ed, over to you.
I love the whole idea of sports and team focused and doing things together is really valuable. I remember when I was a kid, a very, very long time ago now, But playing team sports, I really kind of enjoyed that, and it wasn't just the sport aspect of it, the football aspect of it. It was everything that kind of surrounded that. So I love that all those other kind of components are being a part of healthcare and providing good care for children, and certainly in CP as well. Obviously, I can kind of understand over the last 50 odd episodes of the podcast that there is so much worth in all this physical activity. I do have a question though about team sports and the kind of group interventions that I think you've been talking about, Hércules. Is I know that I loved football because it was a team sport, and I know that other people might enjoy like games like tennis, which is a little bit more introspective, all about the person. I wonder whether there has been any kind of study or work done on individualized kind of sporting scenarios for children, and whether they kind of work better in one form versus more the group kind of intervention. I don't know if I'm being too simplistic about this, but maybe you could shed some light on that for us.
That's a good question.
Yeah, very good question, Ed. I think actually in the moment, at least here in Brazil, we are not running any study like that. But I think it's a very good and important question to answer. So what's better, individual or group interventions? So especially because here in our study, we had here a very provocative title. So moving together is better. So I think here it's very important to look at the data using the bigger lens, all right? So using our lens here, we can see that individually, one study, for example, the Participate CP study, was the unique study that contained a mixture of active ingredients. So, for example, if a clinician, they are individually with a kid, they should, for example, use this kind of ingredients to promote physical activity participation. But Ed, also trying to answer your question, I think this is a very important, and I think the next step, including me and other researchers, is also to look at this and obviously try to run a randomized control trial, or maybe some qualitative study asking children about their perception. Yeah,
That's good.
Because I think, because they can give us pretty much information on that. Yeah. To guide us to the next step. Yeah.
Yeah. And I think a lot of it comes down to their goals and motivations as well. Like if an individual sport, say tennis, is something that they are really intrinsically motivated to participate in and enjoy doing, and it's not because of any kind of external pressures that they feel to do that sport, then they're more likely to engage with it longer term.
That's right.
Regardless of whether it's an individual or a team sport. But, if it's a team sport that their parents are forcing them to participate in because they feel like they should, then they're probably less likely to, to want to do that anyway in the longer term, aren't they?
Yeah, exactly. Yeah.
Oh, it's a really good point you've raised, Ed. Well done. That's a really good one. Well, it definitely keeps us all thinking. Hércules, we have just absolutely loved chatting with you today. We love the pearls of wisdom that you brought. We're just so grateful for your time. And, I'll definitely be thinking about this a whole lot in my intervention. So, thank you so much for joining us.
Oh, it's a pleasure. Thank you guys again. Amazing. Great time. Thank you.
Thank you for staying awake. You can go to bed now.
I'm so
Get
impressed.
some rest.
Yeah, I'm so impressed. My brain would have definitely shut down by now. Yeah, thank you so much. And to all our listeners out there, remember you can always access all of our run sheets and our thoughts that we write onto our website, researchworks.net. And there's a CPD form there that you can fill out as well if you want to keep this as a part of your record of your PD requirements. But for now, we'll say goodbye and thank you, and we'll talk to you all again next time. Thanks so much.
Thank you.
Bye.
Bye.
Bye. Thank you.